May it please the Tribunal, we'd like to call at this time as a witness Dr. Franz Blaha.
Is your name Franz Blaha?
Dr. Franz Blaha.
You're Dr. Franz Blaha, a native of and a citizen of Czechoslovakia, are you not?
Ano.
I understand that you're able to speak German, and for technical reasons, I suggest that we conduct this examination in German, although I know your native tongue is Czech. By education and training and profession, you're a doctor of medicine.
Ja.
And in 1939, you were the head of a hospital in Czechoslovakia.
Jawohl.
You were arrested, were you not, by the Germans in 1939 after they occupied Czechoslovakia?
Jawohl.
And were you confined in various prisons between 1939 and 1941?
Ja.
And from 1941 to April of 1945, you were confined at Dachau Concentration Camp.
Jawohl.
I, Franz Blaha, being duly sworn, depose and state as follows. I studied medicine in Prague, Vienna, Strasbourg, and Paris, and received my diploma in 1920. From 1920 to 1926, I was a clinical assistant. In 1926, I became chief physician of the Iglau Hospital in Moravia, Czechoslovakia. I held this position until 1939, when the Germans entered Czechoslovakia, and I was seized as a hostage and held a prisoner for cooperating with the Czech government. I was sent as a prisoner to the Dachau Concentration Camp in April 1941 and remained there until the liberation of the camp in April 1945. Until July 1941, I worked in a punishment company. After that, I was sent to the hospital and subjected to the experiments in typhoid being conducted by Dr. Mermelstadt. After that, I was to be made the subject of an experimental operation, and only succeeded in avoiding this by admitting that I was a physician. If this had been known before, I would have suffered, because intellectuals were treated very harshly in the punishment company. In October 1941, I was sent to work in the herb plantation and later in the laboratory for processing herbs. In June 1942, I was taken into the hospital as a surgeon. Shortly afterwards, I was directed to conduct a stomach operation on 20 healthy prisoners. Because I would not do this, I was put in the autopsy room, where I stayed until April 1945. While there, I performed approximately 7,000 autopsies. In all, 12,000 autopsies were performed under my direction. From mid-1941 to the end of 1942, some 500 operations on healthy prisoners were performed. These were for the instruction of the SS medical students and doctors, and included operations on the stomach, gallbladder, spleen, and throat. These were performed by students and doctors of only 2 years' training, although they were very dangerous and difficult. Standartenführer Dr. Lolling frequently witnessed these operations. During my time at Dachau, I was familiar with the many kinds of medical experiments carried on there with human victims. These persons were never volunteers, but were forced to submit to such acts. Malaria experiments on about 1,200 people were conducted by Dr. Klaus Schilling between 1941 and 1945. Schilling was personally asked by Himmler to conduct these experiments. The victims were either bitten by mosquitoes or given injections of malaria sporozetes taken from mosquitoes. Different kinds of treatment were applied, including quinine, pyrophor, neosalvarsan, antiparin, pyramidon, and a drug called 2516 boring. I autopsied bodies of people who died from these malaria experiments. 30 to 40 died from the malaria itself. 300 to 400 died later from diseases which were fatal because of the physical condition resulting from the malaria attacks. In addition, there were deaths resulting from poisoning due to overdoses of neosalvarsan and pyramidon. Dr. Schilling was present at the time of my autopsies on the bodies of his patients. In 1942 and 1943, experiments on human beings were conducted by Dr. Sigismund Rascher to determine the effects of changing air pressure. As many as 25 persons were put at one time into a specially constructed van in which pressure could be increased or decreased as required. The purpose was to find out the effects of high altitude and of rapid descents by parachutists. I have seen the people lying on the floor of the van through a window in the van. Most of the prisoners used died from these experiments from internal hemorrhages of the lungs or brain. The rest coughed blood when taken out. It was my job to take the bodies out and to send the internal organs to Munich for study as soon as they were found to be dead. About 400 to 500 prisoners were experimented on. Those not dead were sent to invalid blocks and liquidated shortly afterwards. Only a few escaped. Rascher also conducted experiments on the effect of cold water on humans. This was done to find a way for reviving aviators who had fallen into the ocean. Experiments, Polish, Czech, and Dutch priests were ordinarily used. Pain was intense in such experiments. Most of the 600 to 800 persons who were used finally died. Most of the others became permanent invalids and were later killed. In the fall of 1944, there were 60 to 80 persons who were subjected to salt water experiments. They were locked in a room and for 5 days were given nothing to eat but salt water. During this time, their urine, blood, and excrement were tested. None of these prisoners died, possibly because they received smuggled food from other prisoners. Hungarians and gypsies were used for these experiments. It was common practice to remove the skin from dead prisoners. I was commanded to do this on many occasions. Dr. Rascher and Dr. Volta in particular asked for this human skin from human backs and chests. It was chemically treated and placed in the sun to dry. After that, it was cut into various sizes for use as saddles, riding breeches, gloves, house slippers, and ladies' handbags. Tattooed skin was especially valued by SS men. Russians, Poles, and other inmates were used in this way, but it was forbidden to cut out the skin of a German.